But I'll tell you, the eye-opener for me is your first point, how little of a public health system we have. You realize how our health system is really a private sector system. We call them voluntary hospitals, but they're not for profits, but they're private sector hospitals. And they run their own businesses. We have downstate New York, right? New York City, Suffolk, Nassau, Westchester, that whole metropolitan area. We have about 100 hospitals. We have about 13 public hospitals. And the rest are all private hospitals. And when I had to go there and basically ask these private hospitals, we have to work as one because now this is a public health mandate. They're not public health hospitals. They're private hospitals, and they have their own clientele and their own patients and their own marketing department and their own market niche. And they don't coordinate with the others. They just don't do it, and the capacity and the equipment they had was what the market would support. They didn't create an extra bed in case of catastrophe. They only had the number of beds that they could sell, right, to the market. So there was no additional capacity beyond what the market would pay for. And I went to the hospitals. You'll get a kick out of this. We have 50,000 hospital beds. They were projecting that I would need about 140,000 hospital beds. And we only had a capacity of 50. I mandated that the hospitals create an additional 50% capacity in every hospital. You had 100-bed hospital, you had to go to 150 beds. So they were putting beds in auditoriums, they were putting beds in cafeterias, they were converting everything because you did not have any public health capacity in the entire healthcare system. It's a concept, public health, but there was no physical manifestation of it. There was no capacity. So that's the main eye-opener. This pandemic, we're not ready from a public health point of view for any large-scale epidemic management. So I think when we get a chance to sit back and learn the lessons from this crisis, the big eye-opener to me is, where is your public health system? You teach it in schools, you talk about it a lot, but it doesn't exist. Not in buildings, not in beds, not in equipment, not in staff. And that's what this really showed us. We called up the public health system and nobody came.
Well, I think one of the things that we owe it to the country to do is to try to create one for the next time. And I don't want to get ahead of myself. We got to get a hold of this one first.